So, so the concept of a problem comes when there is a recognition of imperfection and there is a belief of impossibility of a better future. If you have something and you know that it is possible to be changed, then that thing can become a problem. But if a mother gives birth to a child and there are no hands, in the language of research, we may not call that a problem, because it is impossible that we can take back this child in the womb and make it develop limbs, you know? So whenever there is something that you think that you can solve, there's a possibility that somebody can change, or some situation is possible to change, we can call it what? A problem. If you're married to this type of husband who is very selfish from birth, and you know that even the mother has told you that guy was very selfish from the time of birth, and that is his character, that one now ceases to be a problem, because it's something that is inherent in that regard. So when there is a possibility, believe that there is something possible that can get out of this, either we can collect data, we can organize things, we can set systems right and sort of, then we can say that is what? A problem. So in the concept of research, whenever you as a researcher you feel confused about something in the hospital, say if you're in charge of the facility and things are not moving out well, you're unapprehensive, then we can say that there is what? There is a problem. And this can involve asking questions: who, what, where, when, why of the problem. Look, answering all these 5 whys may generate what we call a problematic situation. You don't know what is causing it, you don't know who is dead, we don't know why it's happening, when it's happening, and why it's happening. So research problems are got from different sources. It can be from a personal experience. You go through a certain situation, and then you can get a researchable problem from that. Or from your workplace, you're experiencing something happening strange. You can review literature, past information, previous sources, and say, okay, according to the information reported from the newspaper, there should be a problem that requires to be attended to. And then with theories, this could be a third source of information. Certain shortcomings of certain theories could be researched about as well. Discussion with experts. You are the experts of public health. And so as an expert, the challenges that we are experiencing in the practice of public health. And so we can get a research problem from there. Previous studies, I said one study leads to another study. So one study can generate problems for another study, or limitations that will require to be studied in the next study. We can also replicate studies. One study has been done in South Africa, but we do not know whether it will make the same sense if it is done in Uganda. So we can make that a problem for us to study. Of course, media is a common source. When you're going to study, the question is what is trending, what is on the papers, what is it that every media house is discussing about. We can make that our research problem. We can as well brainstorm, just sit in a classroom here and think about problems that are affecting society, problems that are affecting us as a class. And then we make that a research problem for us. Intuition, natural intelligence, every mind is reflective always. Every normal human brain is always reflective. And ideas strike our minds on a daily basis, new ideas. You want to start up a drug shop, but you're asking yourself, where should I put it? Go do market research. You want to do something new, in a hospital, and you're like, okay, what if I tried something new like this? Can it make impact? So from intuition, from the new ideas that strike our minds, exposure to field situations. Yes, you're working in the refugee camp, you're working in a hospital, and you realize that children from a certain village are coming with a specific kind of disease. They are presenting with similar complaints, and they're coming from one village. You might start wondering as a clinician, why is it that these people coming from this village are having such related signs and symptoms? Or if you're a counselor, you will find that mothers who are coming from certain villages, majority of them are coming for counseling from one village, domestic violence from one village. So you'll be able to identify problems from your field of work. So as researchers, our first thing is to identify a problem. Before you even think of doing any form of a study, you must identify a problem, because where there is no problem, there is no research. Right from the definition of research, we have agreed we do research to solve problems. So if there is no problem, then there is no research. So if there's no question, then there is no research. So there might be a problem, but is it important? Can't it wait up to tomorrow? How urgent do we need to solve it? Can it receive considerable attention? So we have to ask a few questions that will lead us to know whether that problem is important or not. In terms of scope, if in a village, a woman who has been, if you have cases of malaria in a village and 5 of them are being reported, that may not be a problem. But if you get one cholera case or one Ebola case in a society, just one Ebola case, then that becomes a big problem that can attract considerable attention. So when a when a problem, when something is challenging common beliefs, we believe that women must be circumcised, and it is okay for us culturally. But now when you go to the medical point of view, find that female genital mutilation is not healthy. So that from the medical perspective, it is challenging our culture, challenging our beliefs, and so that can be a problem. Inadequacies in the laws are some of the things, some of the policies that are in place are not adequate to address all our problems. And then, of course, implications to a particular area. If that problem is affecting a wider population, then that makes it very important than when it's just affecting one or two people in a society. So a problem that is able to receive considerable and persuasive attention, meaning that if we talk about COVID, it is something that is able to attract attention because everybody wants to see what solution we are bringing on board to help get us out of this. So a few questions to ask. Is it topical? When you're going to generate your problem, is it topical? What is it? What is the current thing that we'll have, what we're going to talk about? Say in the health sector, what is it that we're going to discuss about right now that is topical, that when you submit to the PS, she'll be like, yeah, this is something that we need to solve. If you're going to talk about Drunkukulu's maintenance, you're going to talk about sleeping sickness. Okay, these diseases that have been almost eradicated. Nobody will give you attention. No, but if you're going to talk about situations that are on newspapers, challenges that we have right now, then you can get attention. Then problems that are likely to continue in the future, or its effects continuing in the future. We call that an important problem. If we are talking about floods, you want to go and mitigate floods, and which in Amuria, which are seasonal. People know that those floods, they just come in a few months, they will be gone. So people can endure. They go and stay in a certain primary school for 1 month. When the water is gone, they go back to their homes. But a situation where you have permanent effects of the problem, like landslides in Bududa, and it's most likely going to continue, then we can say, yeah, there is a problem. So how important and which population? Now, when we talk about jiggers in Busoga region, it may not be so much of persuade the political class, you know. The President Museveni may not be so much worried if he reads from the newspaper that there are jiggers in Buyende. But should they report an outbreak of jiggers in Chiruhura, where he knows that the entire world will want to know why is it that where the entire president is coming, there is an outbreak of jiggers. All the artillery will go there, you know, a popular population. So sometimes populations are regarded when there is people want to know who is that is important. If there is cholera outbreak in Katanga, the response may not be as far. But let there be a cholera outbreak in Munyonyo, for example, or Moyenga, among the homes of the rich. All big vehicles will be going there. So sometimes what we see as a problem is also relative to the population. There are some places, some people have gotten used to poverty, and poverty is now for them. Eating 1 meal a day, the normalization of poverty has occurred. But in situations where lack has come, you know, so something becomes topical sometimes depending on the population of interest. And so there's quite so many criteria that will follow. Would the research findings lead to some change in best practice? Yes, we have seen in the health sector, things changing. We used to have Unigold, now we no longer have Unigold. Tomorrow another test is going to come on board. No, at our times, our best drug for treatment was chloroquine, and we survived on chloroquine over the years, but we see that now we have kept on transitioning from chloroquine to now the drugs that we have, and now we are tending towards vaccination for malaria. So when you have done this research, is it going to change practice? So the problem statement is good when it is able to persuade funding, you know, or persuade attention and persuade interest. You know, there are 3 criteria that we always follow when we are defining a problem. What makes a problem researchable? Not all problems need research. There are certain problems that we can just go and read and solve it. There are certain problems that don't need research to be solved. Now, there are 3 criteria here. One, we have said there is a gap. That means that there's a discrepancy between what is existing and what is ideal. So first stage is to identify where there is a gap, that things have deviated away from the normal. They can either mean deviating to the positive or deviating to the negative. Let us say that if in a health center, on average, we are receiving 50 malaria cases on a daily basis, there are 50. If you have an increase of cases per day from 50 to 200, that's a problem. You'll be wondering, why is there an increase in the number of malaria cases? Maybe the interventions in the village have failed to work. On the other hand, if you have a reduction in the cases, we have been reporting 50 cases on average, but this particular time, we are only reporting 10 cases of malaria. That also raises questions. Why are we reporting? Why are there few cases? Is the microscope okay? Are they added to 10? So asking questions, what has exactly happened that this number of cases have reduced? And so we may also want to do research to find out why the number of cases being reported for malaria have reduced. Either people are not coming to the hospital, people are self-medicating from the village, or just things have worked out well. So that's the first thing. deviation from the ideal. That means that for research, what we call a problem is not actually something that is bad. No. In the social world, in our daily lives, when you say I have a problem, that means that something bad has happened. But in research, even good things are counted as researchable problems. Why is it that COVID-19 has not affected the old Ugandan population as bad as it has affected the Italian population or the French population or the French population? Whereas it is good, but it still raises a question. Remember, we said research is generated from a question. So in research, the context of a problem is not bad things alone. It is both good and bad, as long as there is a deviation from the norm. So that's one criteria. The second criteria is that the reason for this gap, the reason for this deviation, we don't know. The number of cases have increased, we don't know why. It has reduced, we don't know why. So we can then go and conduct a research to know why there is a gap, where that deviation has occurred. That's the second thing. The third one, that you have more than one possible explanations for the deviation, but you don't know the best one. If it is a problem, there are more than one solution to that problem, but you don't know which solution is working out well. You want to explain why there has been an increase in the malaria cases. One, people have refused to sleep under mosquito nets. Two, the mosquito population has increased. Three, people are not seeking care on the first day. Now you have all these reasons, but you don't know exactly which reason explains why there has been an increase in the malaria cases. Similarly, there has been a complete decline in the number of malaria cases. We don't know why have the number of cases reduced? Is it because people have adhered to use of mosquito nets? Is it because of climate change? Perhaps is it because the laboratory agents are not working well, they're missing out of the cases? Is it because maybe the lab guys are drunk and they're just reporting results and not even examining the slides? So there can be more than one possible explanations. So in that case, we also do research. So those are the three important criteria that make a problem researchable. There's a discrepancy, 1. 2, the reason for the discrepancy is not known. 3, there are more than one possible explanation for the discrepancy, and we don't know which one is best. I have repeated that one. You're going to get it in the exam. So of course, when the researchable is when the problem is not researchable, then it is the opposite of that. That there is the discrepancy is there, and we know why the discrepancy exists and know the solution. Then there is no need to do what? To do research, to waste money on doing something that we know already the solution to. You know, if you find that your wife is behaving in a certain way and you know why she's behaving that way, then you don't have to do any research on it. But if something is happening and you don't know why, then you can do what? You can do a study about that. So we could identify researchable problems and non-researchable problems, I think, when we go into our discussion groups. So is the problem researchable or not? Is the first question you should ask. Do I need to conduct a study on this problem, or I can just go and consult people and they give me what? Ideas without really conducting in a form of research? Do you have time, and do you have the money, do you have the competence to do the research? So in order to test the feasibility of research, there are internal and external criteria. I'm going to skip through the slides. I will explain them as we go along. The 3 slides up to number 20. So we have internal and external criteria. So in the internal criteria, before you say you begin with your idea that you want to do this research, are you interested? Key and number one, very important, you must never and never do a research you have no interest in, even if there is money for it. You must do something that you're interested in. And essentially, all of us, even at our workplace, there is always something that you are interested in. You're interested in malaria, HIV, TB, whatever, maternal and child health, social issues. There's something that always your heart is driven to. So always do research in areas where you're what? We're interested in. Even if you're interested in that thing, do you have the competence? Make sure that you have the knowledge. No, I get the thing that this thing, you're a midwife, and you wake up, you want to do want to conduct a study on dental care just because you had a toothache last month. Do you have the competence? If you're a midwife, then do your research in the line of midwifery, because that's where your interest is in. That's where you're competent in. So it's not about the gut feeling. If you're a clinician, don't run that to say we want to go and conduct tests in the laboratory where you're going to hire other people. Don't have the competence in that. So do your research within the area of your study. So as we are going to identify topics for each one of us, begin to think of what is it, that thing that you're interested in your field of competence. And then resources. Do you have the time? Do you have the finances? Do you have the people who can support you? Your own resources. Before you first look at for donor funding, are your own resources sufficient for you to do this research? So that's the internal criteria: interest, competence, and resource. The external criteria, one is the researchability of the problem. We have said that, and now we know how to test the researchability of the problem. You must test, is this problem researchable? Does it meet that three criteria we have explained? Two, is it important? Is this problem of very urgent? Can't it wait up to next year or the other years? Can we do without it? Feasibility. Feasibility is the doability of this problem. Is it possible to be done? There are some students who come up with the very wild and ambitious topics. I ask them, but you, man, are you able to do such a study? That study needs an organization or WHO. So you must get something between your capacity, that is, you're able to do, given the time that you have. Say as a student, you're going to do an action research next time. You're given only 6 months to do the study. Do you have the time to do it? So you choose out something small that you're able to do. Facilities, do you have things that can support you? Is there infrastructure? If you are going to do in the lab, are there microscopes that we're going to use? If you are going to collect information in an antenatal clinic, do you have something to use that we can give you? The usefulness is afterwards, after you've collected this study and conducted it. How useful will it be for us and for the general public? Social relevance and research personnel, are there people to support you to do this study? How relevant is it? Will the politicians accept to approve this study? Because you can have a study and people refuse to support you, or you can go to hospital and then the in charge tells you, no. You cannot do this study from here. So it means that you must know whether it is socially relevant to do that study, whether people will accept you to conduct such a study. So we must meet this internal criteria and external criteria, as in when we are going to choose our research problem. Okay, I want to pause there and you can ask questions. I have explained the slides, this in front slides. So there are potential areas. We have less than a minute to drop out. But now when we get back, I want us to now to go into practice. We are going to break out for lunch. Then we come back We come back at 10 minutes past 2. Or 20 minutes past 2. So let's have 1 hour, and then we come back at 20 minutes past 2. We now go into the practice of how to develop a research problem. Okay?
Who has a hand up? I don't know.
Okay.
Yes, sir.